Good evening, parents. My name is Shanie Fletcher. This evening we will be discussing Down syndrome. What is Down syndrome? Characteristics of Down syndrome, the prevalence and statistics of Down syndrome in Grenada, how Down syndrome is diagnosed in Grenada, what diagnostic methods and techniques are used globally, forms of intervention plans, long-term effects of the intervention plans for children and families, and recommendations for parents. What is Down syndrome? Center for Disease Control and Prevention defines Down syndrome as a genetic condition where a child may be born with an extra chromosome. Typically, a child is born with 46 chromosomes, but in this case, we'll have an extra copy of a specific chromosome. Here are some pictures of children with Down syndrome. As we can see, there are some physical features: the nose, the lips, the face, and so on. Characteristics of Down syndrome. Down syndrome children have an obvious physical look and display delayed intellectual and cognitive developmental milestone. So we saw the flattened face, smaller head than normal, a short neck, small or folded ears, or they can be shorter in height than the average child. Developmental characteristics. Intellectual and cognitive development can vary in children from mild to moderate to severe. Some common signs and symptoms include delayed in language or speech. So we may see children with Down syndrome and they do not meet the language requirement for their age. Memory is affected. When a child cannot remember, it makes it difficult to receive and pass on information. Impulsive behavior. So the child may act without thinking and they may take risk, dangerous risk. Short attention span and slow learning. We know that many children with Down syndrome, they may have health problems. So the health problems may interfere with their attention span and their slow learning. So in Grenada, we have a table here. This is the years, the number of children born with Down syndrome, female, male, and how many died. So this is 2015, 2016, 2017, 2018, 2019. So the death rate of children with Down syndrome is low in Grenada. It is estimated that each year, 3 to 9 children are born with Down syndrome. At present, there are 55 to 60 persons on the island living with Down syndrome. Many have medical conditions such as heart problems. The diagnostic methods and techniques used in Grenada to diagnose a child with Down syndrome. In Grenada, we have physical postnatal screening. We do not do a test during pregnancy, during the prenatal stage, but after a child is born. And when a child is born, we may look at the physical features. That's what we do. We also have the observational screening. So a parent might go home with their child. When they go home with the child, they notice that the child is not sitting up, the child is not moving as they should, the developmental milestones are not being achieved. So they may bring the child back to the hospital and then they will do a blood test screening to confirm the diagnosis of Down syndrome. We will make a comparison globally and in Grenada with the diagnosis of Down syndrome. Globally, they have a prenatal screening test, whereas in Grenada, we do not have that. They have postnatal screening, we have postnatal screening. They have diagnostic tests, we also have the observational screening. They have early intervention plans, we do not. So the diagnostic test here involves the blood tests. So during and after birth of a baby, screening tests can be done to check the probability of a child having Down syndrome. During the first trimester and second trimester, a test for chromosomal and other genetic disorders are done. In our neighboring islands like Barbados and Jamaica, they also do the same prenatal test. But in Grenada, due to financial constraints and lack of resources, we do not do these tests. The blood test involves the measuring of protein and hormone levels in a pregnant woman. So if the levels are high or if the levels are low, the child will be diagnosed with Down syndrome. Early intervention programs are very important. So, according to the National Down Syndrome Society, early intervention programs in children with Down syndrome is very important. It offers support, encouragement, and information to enhance growth and development for both parents and children. Early intervention plans include the physical development. It caters for the physical development of the gross and fine motor skills, language and speech development. It involves activities for the 4 languages, the 4 components of language. Teachers should provide opportunities and activities that will promote the gross and fine motor skills in children. The gross motor involves the use of muscles such as the legs and arms, and the fine motor involves the fingers and the wrist. The use of the fingers and the wrist helps strengthen the fine muscles. Teachers should provide opportunities to strengthen that muscle. So they would give children activities such as cutting, using the scissors to cut paper, tying laces, using Play-Doh to form the alphabets and numbers, zipping and unzipping pants, threading blocks, buttoning and unbuttoning clothes, and pouring water in a bottle. We have here speech language development. Children with Down syndrome have problems communicating with people. They have problems understanding and expressing language, and also reading and speaking skills. In schools, teachers work together with the speech pathologists, parents, doctors, and nutritionists to enhance children's growth and development through personalized intervention plans. The 4 components of language are targeted when helping a child develop language: speech, communication, vocabulary, grammar, and speech. Language and speech develop and work hand in hand. They go together. A teacher can help children develop the speech and language by incorporating activities such as reading books, checking comprehension skills, using the 5 W's and 1 H, allowing children time for responses. This is very important. Talking to children, singing songs, saying rhymes, poems, and jingles, teaching phonological and phonemic awareness activities. And if a child uses sign language, learn basic signs and teach children. Long-term effects on early intervention programs for parents and children. It improves cognitive and emotional domains in a child. The child may feel and develop a sense of belonging and independence, and so behavior may improve, creating positive relationship between the child and family. Positive relationships and cognitive development help a child achieve academically and socially, and so the child IQ may increase. 2. Education. With early intervention, the child may develop higher educational achievements, and so this can decrease special needs. With education, the child may be able to find a job and reduce the financial burdens on the parents. Money and education help improve the living conditions of a family. 3. Welfare, work, and crime. A child with Down syndrome may be able to find a job and take care of themselves financially. This reduces the need for dependency on the state for an income. Parents may have less financial responsibility. Independence, education, and money may reduce crime rates. Here are some recommendations for parents who has children with Down syndrome. Join a support group or the Down Syndrome Association in your country. The association is made up of parents who has children with Down syndrome, professionals, and also other people who has interests. In the association, you will be able to talk to other parents who have children with Down syndrome. They can be a foundation for practical advice and emotional support. Take care of yourself. Children with Down syndrome require extra work, time, and care. It is important that you, as a parent, eat well, exercise, and find time to distress. You can find time to go on the beach or to a restaurant to eat.